The global trend shows that about half of the world's population in rural areas. Few of them are covered by preventive examinations. What is happening in rural healthcare today? Outdated medical equipment, acute shortage of doctors and nurses, worn-out vehicles and bad roads. What do we get as a result? Significant increase in chronic diseases and increased mortality rates. The mobile diagnostic complex is an ideal solution for primary healthcare. In many countries around the world, primary healthcare facilities are located in inaccessible areas, from where the nearest hospital requires traveling hundreds of kilometers. The main obstacle to affordable medicine is the lack of modern diagnostic equipment. To improve the health of rural residents and comprehensive prevention, we propose to use a modern diagnostic complex. It collects and transmits all information about the patient's condition remotely to a specialized doctor. The mobile complex is designed for remote collection and transmission of medical information for preliminary diagnosis and remote monitoring during the treatment and rehabilitation of the patient. The diagnostic process takes from 15 to 30 minutes. Diagnosis of the patient begins with filling out personal data. The system works online and offline and stores information from surveys of more than 1,000 people. The patient's body mass index, bone mass, and percentage of fat and water content are determined. Blood pressure, temperature, saturation, and pulse are measured. All devices have wireless data transmission. For example, an electronic stethoscope has the ability to record sound for listening on other devices. Spirometer is performed to assess lung function. A general urine test is taken. Blood test for hemoglobin, hematocrit, leukogram, and biochemical blood test. A biochemical blood analyzer is used to monitor patients with diabetes, kidney and liver diseases. The collected information automatically enters the patient's health passport, which makes it possible to read the received data to a medical specialist anywhere in the world. The complex has built-in artificial intelligence, which prompts the diagnostic results to the doctor. The mobile complex is an ideal primary healthcare tool for individual localities, which conducts functional and laboratory diagnostics within 15 minutes, for which nursing staff or paramedics are required. Using a mobile health diagnostic system will solve the following problems. Ensure accessibility of medical services to the population of remote rural areas within the framework of primary care. Increase the efficiency of primary care medical organizations, while simultaneously solving the problem of shortage of medical equipment and medical personnel. The use of the complex makes it possible to provide medical care on site, observing the golden hour rule. Moreover, the complex makes it possible to detect coronavirus infection at primary signs and monitor the patient's condition during the course of the disease and during subsequent rehabilitation. And most importantly, mobile diagnostics will make it possible to identify dangerous non-communicable diseases in the early stages